Bonjour à tous.
Good morning, everyone, ladies and gentlemen. I represent the General Director of IRS, Mrs. Guerrier, who cannot be with us, the Director of the Regional Health Organization. So I would like to come back to the situation of people who suffer from polio. That's about 50,000 people, and we know that those patients are divided into two groups. So as Mr. Chéret said, the ones who got this disease during the big pandemics in the 50s, and our region was particularly affected, the Lorraine region, the Alsace region also. And finally, this is what justifies the motivation and the involvement of all the associations of the region. There's also in France people who were affected younger, where vaccination was later. In other countries, people who were immigrants, and they can be affected at different levels depending on their social and cultural communities. So when people come from countries where vaccination happened later, sometimes we have to cover the initial phases of the disease and the aftermath that were very different from one country to the next. Today, we know that people who were affected by polio can have secondary complications because of age and some specific complications to the disease that is the PPS. So in France, it's only recently that some specific needs for PPS people were recognized. So this was done in rare disease, in the rare disease framework, focusing on the issues of these patients from 2004. That was a public health law. And then in France, several sections have been set up, rare diseases, and one focuses more on neuromotor diseases. That's a FILSAM framework. We have two reference centers who are located in Nancy and Strasbourg. So it is only very recently that the diseases linked to polio and aging were included in rare diseases. And in June 2022, a national healthcare protocol was drafted concerning the aging effect on these people. So what was our role then? So in a region where we have more than 5 million inhabitants, you know, the people affected are a low proportion of the small proportion of the population. There's about 5,000 of you who have this disease. But we wanted to have an individual view, and this is why with the Regional Health Observatory, we carried out a study to study the path of these people. And these people usually have a hard time getting a diagnosis and some health care, with inequalities also, because it is very difficult for them to have the right access to the right specialist at the right time and at the right place adapted to their needs. So the mobilization of the Polio Association was very important, especially in our region, to set up our health regional project that goes until 2028. That has allowed us to include these issues in the many priorities of this healthcare project. And I wanted to mention very briefly three axes that you are interested in for these patients. First, to change the healthcare system. The polio sequelae have been included in one of our priority pathways for neurodegenerative diseases. We have an axis that concerns the improvement of access to healthcare for disabled people, elderly people, and people who are in a fragile situation. So even if autonomy has been maintained after they recovered from the acute disease, thanks to the willingness of people affected and their families, aging might jeopardize their autonomy, and that's something we have to take into account, because that's another fight that society has to take into account. And there's another axis concerning innovation. We will have an innovation policy that will help help transform the healthcare system. And in our policy, we support innovations at the service of users, and especially within the framework of Article 51, but also throughout regional initiatives. So this is why we committed in an innovative project that Dr. Lochbin will introduce, and I would like to thank her for her work and commitment on this issue. She will present this with Dr. Martinet. So I won't say much about this, but I can tell you that the General Director has already confirmed the financial support to this innovative project. So the first regional health scheme has worked on defining the requirements and trying to develop some responses, and we ended up with a roadmap at the regional level. Of course, the healthcare crisis has slowed down our efforts. We are sorry about this. For all the people involved, for all the associations that you represent, thank you, Mr. Cordier, and all the associations for all the work you've done. And I would like to seize this opportunity to congratulate you for all your energy, for representing the patients, and thank you for the work you do within this partnership. So this partnership with the users, the healthcare professionals, has led to the creation of a regional center specified in polio, and we will present this later on, that complements the offer from the FELSAM centers, and it inaugurates the healthcare scheme that we have until 2028. So thank you again for your commitment, your involvement. We wish you a fruitful day. Thank you.